My name is Suhasini Rodriguez and I'm a fourth-year medical student from All Saints University School of Medicine, Dominica. I'm very happy, and in fact I think I made the best decision by joining JPH. JPH has offered me all that I thought I could have got. First and foremost, plenty of hands-on experience under the supervision of experienced doctors. I enjoyed the most at Jackson Park Hospital is the leadership role, a friendly atmosphere, lots of hands-on experience. I appreciate the support that we have here out for students like me. I'm so happy that I have advisors who belongs to the same background like mine that I can go for guidance. The preceptors out here are very supportive and they'll help you to learn and improve your skills and knowledge so that you can function as a doctor. For example, I was given an opportunity to be a group leader 3 times of a student group. I was also given an opportunity to present a case study at a tumor board. Now the tumor board is a monthly meeting where all the specialists meet together and discuss the cases. So what more can I ask? I think JPH is the best. CMTC provides incredible support system. We have a very easygoing and supportive director of internal medicine. We have ICUs where I learned a lot how to intubate the patients. We have dialysis unit where I learned about different pumps and how to use them. We have seminar lectures where the doctor would take us with him every Wednesdays to Rush Hospital and also to Cook County hospitals for those lectures. We have dry and wet simulation labs where the students practice different procedures like IV insertions, Foley's catheter insertions, chest tube placements. We also have an OR where I was given an opportunity to scrub in and assist the doctor to perform the procedure. This is the only hospital that when I was looking at the list where I came across about housing. Now the JPH housing is right besides the hospital. The location is very convenient. The grocery stores are within 3 minutes walking distance. And we have a bus stop right outside the JPH housing apartments. The other thing about this hospital that I really liked was the preceptors. We had 3 different preceptors just for internal medicine rotation. So that gave me an opportunity to learn from different preceptors, different perspectives, and that helped me to improve my skills and knowledge in different areas. From non-academic point of view, we have University of Chicago, which is 5 minutes away from the hospital. We also have library, and we also have Hyde Park, which is close to the hospital. So in case if anybody wants to unwind from their busy schedule, there are lots of pubs there that you can go to. I had different preceptors for my internal medicine rotation and surgery rotation, but it is the preceptor from my surgery rotation that helped me and inspired me the most. He was a very dedicated, hardworking, intelligent man. He did not only have the knowledge, but he had ability to deliver the knowledge to the students. So he was able to teach, and he had a great command over language. I remember the thinking in his class was so intense that it really gave us mental diarrhea. We were very exhausted after we attended his classes. Now, he did not only enhance my knowledge, but also increased the depth of my critical thinking skills. He taught me to better communicate with my patients, gather information from the chart, observation, detailed history taking, perform physical exams. He also taught me to collaborate with the other healthcare team members like consultants, nurses, social workers, lab technicians. He also encouraged us to have meetings with the family members to have family discussions. I remember one day the radiologist called from the lab and said that the radiologist had seen the largest abdominal aneurysm on the CT scan. And I remember this preceptor encouraged me to take the leadership role and assign duties to the other students. So delegate tasks, which basically encouraged us to have teamwork. This preceptor also encouraged us to report discharges to the Vice President of Patient Care. Besides that, he also helped us to write case reports for publications. The wealth of knowledge and experience that I received from JPH Hospital is simply incredible. The other rotations that I had were less rewarding because of the limited real active learning. The preceptors at the other rotations mostly did the work. They did the physical exam, they did the history. I basically observed them. Most of it was observation and assisting them with the paperwork. So I think the rotations at the other hospitals were basically passive learning. Now, when you compare that to JPH, the JPH rotations were full of discussions and meetings. I remember we had to do a lot of brainstorming, wherein if we had to treat a patient with hypertension, we had to say why we are choosing a diuretic or why we are choosing a ACE inhibitor and why not clonidine and so on. So I think the rotations out here were much more rewarding than the other rotations. Overall, I think it was a great learning experience that I had at JPH, and I would highly recommend the other students to consider JPH to do their clinical rotations, and I'm confident that you will not regret being at JPH because you have everything to gain out here.